welcome to my YouTube channel. This is Lucy here. Wow, guys, this has been such a long time, and I'm back now. Well, I was at school and I was writing my exams, and now I'm done. So I'm going to be with you guys. Yeah, for those who've not yet subscribed to my channel, please remember to subscribe to my channel if you want more amazing educational videos about each and everything you want to know, or each and everything you want to learn about. Well, first of all, okay, this has been such a long time, and I'm kind of feeling nervous right now. Well, but anyways, don't mind me. So for you guys today, I just wanted to ask you guys if there's any video out there or anything you want to learn about. You can just drop it in the comments below so that I can be able to make videos for you guys which are well simplified and amazing to understand. Yeah, and well, I don't know why I'm so nervous. Yeah, please remember to subscribe. You're going to enjoy my videos and everything. So today I just had something little that I wanted to teach each and everyone out there, because so many people are killing themselves. They're committing suicide because of some of the situations that they're going through. So I just wanted to teach something little about depression, what depression is, so that in case you're going through depression, you can easily seek for help, and people can easily help you. You can find somebody to talk to you about it, because by the end of the day, you're not going to go through those hurtful feelings on your own, but you're going to find somebody who's going to give an ear to you, and they're going to be able to at least comfort you, and you're going to find your peace immediately. So before I even go into our discussion, which is depression, I'm just going to remind each and everyone, please subscribe to my channel. Yeah, please subscribe to my channel. If it's your first time viewing my videos, subscribe to my channels, please. I'm really going to appreciate. Did I say channels? Channel, yes. So we're now going to begin. Let's begin. So I'm simply going to define what depression is. I'm going to talk about what depression is, the types of depression, what are some of the causes of depression, and I'm also going to talk about how you can further manage a person who's having depression. Or maybe if you're depressed, you're going through something and you don't want to feel like that anymore, I'm going to tell you some of the theories that you can approach that can help you overcome the depression. So depression is simply defined as a global mood disorder. It's just a mood disorder that is characterized by a profound sadness for more than 2 weeks. So you can be sad, but as long as it's not more than 2 weeks, you're not depressed. So depression, this is just profound sadness which should last for more than 2 weeks. It can be characterized by having insomnia, being mute, and not being able to involve yourself in certain activities, starving yourself, and having poor personal hygiene. So those are some of the signs and symptoms of depression. There are many signs and symptoms of depression, but these are just some that I'm mentioning. Yeah, so we've got two types of depression, and the two types of depressions that we've got endogenous depression, which is also known as psychosis depression, and we also have exogenous depression. So this type of depression is also known as neurosis or reactive depression. So when you talk about endogenous depression, this is the type of depression that comes about due to internal factors. And some of the factors which have been researched is that it can be genetical. It can be due to neurotransmitter imbalances in the body, and it can also be due to head trauma. Those are some of the factors that contribute to endogenous depression. When you look at exogenous depression, just like what it's saying, exogenous. So exogenous depression, this is a type of depression that comes about or which is triggered by external factors. So external factors can be due to losing a loved one, losing property, and maybe it can be due to failing an exam. So those are some of the predisposing factors that can lead to somebody having exogenous depression. So if we're trying to differentiate between endogenous depression and exogenous depression, is that you find that people who are having endogenous depression, they are likely to have hallucinations and delusions. And hallucinations, these are just simply a false perception of external stimuli. Like for instance, you're perceiving something that is not existing. So you find that the people that are having endogenous depression, they're having hallucination, delusions, which are false fixed beliefs. You're going to find that they cannot be, their depression cannot be treated by counseling or maybe by talking to them, but they require medication such as antidepressant, examples which can be tricyclic drugs, which are imipramine. So those are some of the drugs that can be used to manage these people who are having endogenous depression. When you look at exogenous depression, you'll find that these people, they can easily be managed by either counseling or talking to them, or maybe just by involving them in group therapy, by involving them in family therapy. These are some of the ways that can be used to manage a person who's having exogenous depression. And these people, are going to find that they do not have hallucinations, they do not have any delusions, and yeah, just like what I said, they can be treated by counseling. So those are some of the types of depression. Maybe there are some out there. You can just go and read further and keep learning new things each and every day. So these are some of the types that we have. So just like what I said earlier, the signs and symptoms can be mutism, flat affect. There can be poor personal hygiene. The person will not want to eat. They're going to have insomnia. So those are some of the signs and symptoms a person who's depressed is going to present with. And just like what I said, so for you to manage this person who's having depression, it depends on the type they're having. If they're having a type of depression that is caused by external factors, which is exogenous depression, you can easily talk to these people in a calm way. You can form a therapeutic relationship with them. You have to make sure you also do a risk assessment, because these people that are going through depression, they're likely to do anything because they feel worthless. So you have to do a risk assessment, which are going to check for societal cues, societal threats. You're going to assess for those. You're going to counsel them. You're going to tell them you're there for them. You let them ventilate. You have to be there, give them support, show them positive regard, and just be there for them. So that's a quick summary of how you can manage a person who's having exogenous depression. But if the person is having endogenous depression, so how we can manage this person is that we have to do a mental state exam. When we do a mental state examination, we find that this person is having hallucinations, delusions. We have to now immediately put them on medication. We have to make sure we put them on medication, which are antidepressants, which can now help stabilize their depression and bring them back to reality. So these are just some of the things you can use to manage a person with depression. Yeah, guys, so we've come to the end of our discussion. I hope we've gotten one or two things about depression and how we can manage depression and how we can go about. So no matter what you're going through, just know everybody is there for you. People have you back, and don't try to feel as though no one is going to listen to you. Express yourself, be happy, and remember to always do what makes you feel good. So guys, that's the end of our discussion. Don't forget to subscribe to my channel. Bye. Every single day, I'm gonna